12.
Weekend Wellness is brought to you by Synergy Health Center.
Now, Weekend Wellness with Brittany King and Myra Lawrence on CFAX 1070.
Good afternoon and welcome to Weekend Wellness. Thank you so much for joining on the show this afternoon. We are online at weekendwellness at cfax1070.com. If you have any show ideas or any feedback for the show, we would love to hear from you. So we had the Oak Bay Cool Half Marathon not too long ago. This weather is certainly gorgeous and we're getting into that running season, or, well, I guess we're in Victoria, so the running season is all year round. To talk all things running and orthotics and good running, I guess, posture from Synergy Health on Quadra and Mackenzie, Dr. Jamie Grimes, chiropractor there at Synergy. Thanks for joining us on the show this afternoon.
Thanks for having me. I appreciate it.
So you, Dr. Grimes, have been, you've done orthotics at Synergy for 14 years now. You have a lot of experience. This is maybe a stupid question, but what are orthotics?
17 years I've been doing them.
Oh, wow.
And orthotics are basically inserts that we place in our shoes, or nowadays you can place them in almost any footwear, to help restore normal biomechanics of the foot, which of course the foot bone's connected to the shin bone's connected to the knee bone, etc. So as long as your feet are functioning properly, then we know the mechanics of the rest of the body will be more optimal as well.
So how often do we need orthotics? Are they mandatory or?
They're not. I mean, not everyone needs orthotics. Some people genetically have better biomechanics than others, and some people who have genetically hypermobile joints or loose ligaments, so their arches collapse, their shins rotate inward more, and they have more difficulties with knee pain, foot pain, hip problems with running or higher impact sports. And so it really depends. On some people acquire overpronation from years of injury, being on their feet, or a long history of high-impact sports. So it's very dependent and on the person, so it's very individual.
You mentioned pronation. I feel like that's a buzzword in running. You hear it all the time. What is pronating when you're running?
Well, pronation is a normal mechanic of the foot. Overpronation is what we don't want to see, or oversupination. Most people overpronate, and that's kind of what most people refer to as their ankles rolling inward, or their arch falling inward. We're supposed to see about 4 to 6 degrees of pronation with a normal step, but if the foot is extremely weak or the ligaments have been stretched out over time or they're genetically hypermobile, then we'll see more than that, and then the arch collapses further than it should, and that puts strain on all kinds of ligaments, tendons, bones, joints in the foot and upward.
So if it's our ankles rolling in, then are there exercises that can make our feet stronger so that doesn't happen as much?
That's a great question, because people think, and there's lots of information out there about running barefoot and using minimalist shoes to try to rebuild and strengthen your own muscles so that you don't need orthotics or prevent overpronation. But realistically, for somebody whose ligaments are stretched out, especially if it's beyond a certain point, the muscles in the foot are not strong enough to hold our arch up entirely. It's a combination of the articulating shape, or the interlocking shape of the bones in the arch of the foot, plus some of the tendons that come down from our shin and wrap under the arch, and the muscles in the foot. They all have to work together. The muscles in the foot are very small, so just like your biceps, you can imagine if you're trying to hold your entire body weight up with your biceps all day long, it's impossible, and that's a muscle that's 5 times the size of any muscle in your foot. Mm-hmm. The muscles in the feet alone cannot hold your arch up. So it's a myth to think that if you just do a bunch of strength exercises for your foot, that will cure overpronation. It will do it if your ligaments are not too loose and the bones are articulating the way they should. Then strengthening the muscles can restore some normal pronation in people that only have a mild amount. But people with more of an excessive amount of overpronation, it's not likely that strengthening the muscles alone will do it.
Okay.
It's very individual. Some people it may work and help. We always want everyone to have strong feet, but it doesn't mean that it's always going to solve the problem for them. And that's where orthotics come in as a very simple, easy solution for those people.
So say we are overpronating and we're not wearing orthotics. Where are we feeling pain or discomfort in our bodies?
Most people will come in with, especially if they're active or they're running, they will notice pain under the kneecap, patellofemoral syndrome. People who start running and jogging and things may get shin splints on the inside of their shins. One of the most common things is people start getting arch pain in the arch of the foot, or plantar fasciitis, where they get pain where the fascia and the muscles attach at the inside of their heel bone. And another extremely common thing is hip problems. So a lot of hip tension, hip tightness, and even sometimes sciatica if the hip muscles get too tight from the knee always twisting inward.
And so you're saying it could all just be a matter of getting a good pair of orthotics to correct that?
Absolutely. I mean, we look at everything and we rule out all causes, but for many people, it's and another one I didn't mention that's very common is IT band syndrome. Is also another common one with runners, but is related to overpronation. But yes, absolutely. For many people, it's really just getting their feet supported the right way, and then ensuring their mechanics are good in terms of the way and the technique and how they run or any other activity they do, and then just making sure that there's no strength imbalances that also need to be fixed. So sometimes it's simple as an orthotic. Sometimes it's a combination of that with some strength work and some stretching and work.
So is running the usual suspect as far as all this pain? Is that the biggest cause?
Yeah, I would say so. I mean, the people that get the most problems, it's from running or higher impact activity like, tennis, squash, volleyball, basketball, a lot of high impact jumping, hopping stuff. Those are where those sports are really going to bring out an imbalance. People who are doing those activities are going to notice it more than someone who's not doing much at all, right?
Absolutely. And that's funny that you say that, because we had the Oak Bay Cool Half Marathon a couple weeks ago. And it was this time last year that I was unable to do it because while I was suited up with a great pair of shoes, they maybe weren't necessarily the fit for me. And a month into training, I got that kneecap pain that you were talking about that's affiliated with overpronation. And I went to a chiropractor. I'd never been to a chiropractor before. And they recommended not only orthotics, but that I continue to see this chiropractor 3 times a week. And I thought to myself, if I have to see a doctor 3 times a week to exercise, maybe I should choose another exercise.
Yeah, it doesn't need to be that complicated. Usually if you're overpronating significantly and you get the right orthotics and the right fit, and you rule out any imbalances, you don't have to be, doing exercises or getting treatments 3 times a week to correct it, unless you've got an extreme imbalance or scar tissue or contractions or things like that. If it's purely mechanical instability and imbalance and you support that with an orthotic and some simple, easy home exercises, usually you can resolve that. And, of course, always slowly building into any activity, so not overtraining or doing too much too soon. It's not something that should require 3 times a week, unless you have a significant problem already, like an actual inflamed injury or scarred or damaged tissue, then yes. But again, it's really dependent on your particular case. But if you're just getting a little pain under your knee from running, typically, and you don't have any major imbalances, and you do overpronate, getting an orthotic should make a big difference in that, and then we just ensure that the muscles aren't too tight or they're not too weak.
Right. Yeah, I guess my question or comment there was, you mentioned running being a high-impact sport, but it sounds that if you're with a good pair of orthotics, if that's what you need, you can still do it. I think a lot of people say, oh, running's too high impact, I stay away from it, it's bad on your joints, don't run. But we just need the right equipment, right?
Yeah, absolutely. I mean, so many people come in and they're like, I can't run. I was told I can't run. I was told that my body's not designed for it because I overpronate or my shins turn in. And the truth is, with the right mechanics, and now there's so many things we can do, like orthotics. We can get people being active and running who otherwise thought they couldn't, just by creating that support. So a lot of people don't realize they could be out being active and running and doing these types of sports. They just need to have their mechanics looked at and fixed, and using an orthotic is one of the quickest ways to do that.
Excellent. Dr. Jamie Grimes, chiropractor at Synergy Health on Quadra, and over 17 years experience with orthotics at Synergy. We're going to take a quick break and come back, talk more about custom-made orthotics versus over-the-counter, and seeing a chiropractor. You mentioned, Dr. Grimes, imbalances. I have a couple chiropractor questions for you, so we'll take a quick break and be back with Dr. Grimes on Weekend Wellness in just a few.
You can't swallow your tongue. Neither can someone having a seizure, so don't stick anything in their mouth. You could break their teeth or choke them. Just lay them on their side, away from sharp objects, and remain calm. For more information about seizure first aid training or to find out about other services, please contact the BC Epilepsy Society at bcepilepsy.com or at 604-875-6704. A message from the broadcasters of British Columbia.
It's just a fact that over the years, and for many reasons, hearing health can diminish. Even people speaking loudly and clearly can sound like they're mumbling. At Connect Hearing, we'd like to change that. Call, book online, or come in to book your free hearing test and ask about our special 3-week hearing aid trial so you can hear the difference for yourself. This offer only lasts to August 31st. So call Connect Hearing at 1-888-355-4170 or visit connecthearing.ca and stay connected.
A new roof is a big investment, one of the most important decisions you can make for the protection and value of your home. Before you do anything, look into a steel roof from Irwin Industries. It's fireproof, moss-free, with clean lines and concealed fasteners. Available in over 40 colors, your new roof will last virtually forever. When it comes to the roof over your head, go with a proven system from a proven company. Irwin Industries, 875 Viewfield Road, irwinvi.com. Call 382-5154.
When traffic is heavy, there's nothing like being on a bike. I mean, look at those snails trying to maneuver around each other. Feels good flying down this road, getting my exercise. Nothing but heavy traffic behind me and a parked car in front of me. Oh, parked car!
When you need emergency glass repair, First Response Glass has what it takes to get the job done.
I'm okay. I'm okay.
In Saanich, on Glanford, and on Van Isle Way in Langford, First Response Glass fixes it.
From physiotherapy to personal training, chiropractic shockwave, and spinal decompression, Synergy Health Center has you covered.
At Synergy Health Center, we have everything you need to achieve your total body health and wellness goals. A health center for pain, injury, or sports performance services. A fitness and weight loss center for improving and maintaining a healthy lifestyle. And a medical center with surgeons and medical services. We've got you covered as Victoria's integrated health and wellness team. Call today and book your complimentary, no-charge personal training session, pain and injury assessment, or weight loss consultation. Visit us at synergyhealthmanagement.com.
Welcome back to Weekend Wellness on CFAX 1070. You're with Brittany King. Big thanks to Dr. Jamie Grimes, chiropractor at Synergy Health on Quadra and Mackenzie, speaking all things orthotics to get us running as healthily as possible this summer. Before the break, we were talking about, yes, running is a high-impact sport, but if you're armed with the right tools, you can absolutely do it. Dr. Grimes, what is the difference between custom-made orthotics versus over-the-counter?
Great question. Custom-made are specifically designed for your own foot and your own foot's mechanical problems or shapes. So it means that it's involving some type of an assessment where we either cast or electronically or digitally measure your foot function and movement, and then we create the orthotic custom designed to fix any mechanical issues that your feet have. So it's individual to each foot. Over-the-counters are generic, so it's just one shape fits all type thing. They provide arch support. They generally don't provide much in the heel or much in the forefoot. It's strictly arch or midfoot support, and it's not custom to your foot. So it may control your overpronation, and generally they will give you some support, but only typically in the arch. However, it may not be enough, it may not be in the right place, maybe too much even in some cases, and they generally do not last as long. But of course, they're much cheaper. And in some cases, for people with mild overpronation issues, they can work very well too.
Okay. So you mentioned, of course, the cost and the price factor. What is the cost of custom-made orthotics these days?
Custom-made orthotics prices range somewhere around $400 for most places. There's places that go up to close to $500. There's places that are just under like $375 to $400. It floats around $400 for a custom-made. Most insurance companies cover it, and most people who have extended medical plans have orthotic coverage of some degree. Many are 80% or more. And the non-custom or the what we call accommodative or off-the-shelf orthotics, they range from $35 to $65, $75.
Okay. How long do these custom-made ones last for? Because you mentioned that they do last longer than the on-the-shelf ones.
Yeah, custom-made orthotics will last longer. They obviously get better results because they're custom-made, but they will last about, we recommend 2 years for semi-rigid orthotics. There's a big history of orthotics were used to be made rigid, so the very hard plastic type. We've moved away from that. That's only something we do with people who, are maybe very heavy, and we need something that's going to hold. Semi-rigid, those, of course, they'll hold their shape for 10 years.
Wow.
But it's not necessarily good for you because when your feet don't move, the muscles atrophy, and our feet are receptors for the brain. They have what we call proprioceptors, or position sensors, that tell the brain how the foot's moving, what's accelerating, decelerating, and then that sends signals to our feet to control the movements of our foot and our ankle and our hip. If you're in something that doesn't allow your arch to move at all, you lose those receptors, you lose that feedback loop, and we actually lose coordination, balance, agility. Semi-rigid, most people now use, they flex more and they give more, but that means they wear out faster.
Okay.
So they usually will last about 2 years before you should get a new pair, which most plans will cover that, but it's really important to get them renewed every couple of years. It's a bit of a trade-off from the rigid ones, but you're getting better biomechanical function. Your feet still move, so you're still utilizing your muscles, and you're not going to get atrophy. The rigid ones are like wearing a cast. And of course, we all know what happens when you wear a cast. The muscles atrophy. So we want to get the best of natural function, and a semi-rigid orthotic moves much like the natural movement of the foot, but never lets it collapse past a certain point. But of course, because it has that a bit of flexibility, it does wear out within a couple of years.
So then we're taking it out of each pair of shoes and putting it in the pair that we happen to be wearing that day? Because I've never worn orthotics, but I don't imagine you get several for all your shoes.
Some people will do that, but you can get one orthotic that you can move to all your shoes. So that we do have different types that will fit in almost any shoe, and then there's ones that are really specific only to shoes that have liners, like running shoes, street shoes, hiking boots, etc., where you can take a liner out and then put the full-length orthotic in. But there's also sort of what we call half-length or metatarsal-length orthotics. Those can fit in almost any shoe, and you can just put covers like over ear or your liners on top of them and use those in running shoes and hiking boots as well, just with the cover on top. So depending on the types of shoes you wear, most of the time we can find an orthotic that's going to fit everything. Some people will buy one for their dress shoes and a shorter one, and one that's bigger for their athletic or hiking or shoes that have liners.
Okay. So with all your experience, Dr. Grimes, with the orthotics, you're a runner as well, I know. What goes through your mind when you're downtown and you see girls in their ballerina flats or those UGG boots with zero support? What do you think about?
Oh, God. It's weird because it's like we could see, knowing the mechanics we know, we see things all the time. And it's pretty bad. I mean, and I see people running down the street, and I can see their mechanics are off because I do video analysis for runners as well, and you just want to stop and say something because you know they're going to run themselves into pain or injury, but obviously you can't annoy people. But I can't stress, enough how important it is if you're going to get involved in running or any activity where on your feet a lot, it's really worth getting just a quick checkup, with your chiro, your physio, or your podiatrist, just to see what your knees are doing, what your feet are doing, what your hips are doing, and it'll save you so many problems. Because once you get a problem, now you need 5, 6, 7 treatments to fix it. One treatment to check all your mechanics will save you, all kinds of pain and suffering, and preventing you from being active and loving the things you love. But I do cringe a lot walking around downtown.
I love it. You're judging all of our pronation, our overpronation throughout downtown. Dr. Grimes on the street, you should give people feedback. I think that would be nice, a free consult.
Yeah, I probably should. Maybe they'd appreciate it.
That's awesome. So you are, of course, a chiropractor as well at Synergy. Say someone goes for their very first chiropractor appointment. What does a chiropractor do, and what does that initial consult entail?
Well, chiropractors nowadays do a lot of different things. There's pretty big scope. Some of us are more prevention, family, spine injury based, and then there's chiropractors like myself that do a lot of soft tissue work. I do a lot of acute injury, but also chronic injury, chronic soft tissue injury, complex cases. neurologic disorders, so herniations, disc injuries, spinal injury. So we do so much more now than just adjust backs. In fact, there's patients that I've never adjusted because that's not what they need, and they need rehab, or they need shockwave therapy for an enthesopathy or a tendonitis, or they need decompression for a disc herniation. So there's quite a variety of things that we do nowadays. We kind of have evolved, like physios and massage therapists, to encompass techniques from all different disciplines. But the first assessment is really looking at what your problem is, determining what it is that your goals that you want to achieve. Most people come in with a condition or something they want fixed. And so the first time is really just running through a history, series of orthopedic, palpation, motion testing, and then determining, and biomechanical testing, and determining what's wrong. And then we can create a plan. And of course, every injury has different treatments that work best for it. So we always say the more specific the diagnosis, the more specific the treatment, and then the more specific the result. So we want to get the most specific tissue or mechanical injury or diagnosis that we can get, so we can get the exact right treatment, which is going to get results faster and not waste a lot of time on things that don't work.
So for those listeners of ours who have seen a chiropractor before, I'm sure they're familiar. There's one exercise, and I've only seen a chiropractor a few times last year, but I remember being asked to put my arms out in front of me, and he put weight on one side of my body, and I had to resist, and then he did it on the other arm, and it's amazing how much more strength or balance you have on one side of your body compared to the other. Can you speak on that?
Yeah, most people or we know people are right-handed versus left-handed. We also have right-footed versus left-footedness. So most of us have little bits of imbalances, and especially if we've ever been involved in sports or activities that were one-sided, we'll all tend to have one side that's a bit stronger than the other, and that's quite normal. What we don't want to see is gross abnormalities from one side to the other. So there should be both should have good strength and stability. It's okay if one is a little bit more than the other, but there shouldn't be extreme weakness, right?
Okay. So orthotics, a chiropractor, balance. Thank you so much, Dr. Grimes, for coming to the Oak Bay Half Marathon a couple weeks ago. You were there afterwards when all the runners crossed the finish lines, and we're doing some on-the-spot treatment, right? That was helpful.
Yeah, we go to that event every year, and it's always a fantastic event for us, and it's always wonderful to get people after their runs and see how their runs went, and also help a lot of people find out what's their injuries, because they come in with these problems from the run, and we can find out right there, give them some free advice, give them a quick assessment, and sort of get them on the right direction, right? Because a lot of people in the half are working towards a full marathon, and now's the time to get things worked out. So we really enjoy working at Oak Bay Half and being able to help out people. It was an awesome event.
Wonderful. And tons of experience, tons of professionals at Synergy Health. You guys are on the corner of Quadra and Mackenzie. Dr. Jamie Grimes, thank you so much for joining me on Weekend Wellness this afternoon.
Thanks for
Need a
having me.
ride downtown?